This is a presentation on how to document your periodontal assessment in Eaglesoft for your patient. You will need to make sure, of course, that you are in your patient's chart. You'll have your patient's name and ID number here. You're going to navigate to the top ribbon and you are going to double click Perio. When you do that, your new Perio exam chart is going to appear. The first thing you want to do is you want to make sure that you have the appropriate teeth marked as missing. Now, if you have already done your dental charting and you've already determined which teeth are missing, that will automatically transfer to the Perio exam. And you'll notice that because there are some teeth here that are in red. If the teeth are in red, that means that the teeth are missing. Now, say you wanted to do your periodontal assessment before you did your dental charting, then what you would need to do is manually make these teeth missing. And how you would do that is you would select the tooth that's missing. So let's say number 28 is missing. So I'm going to click on 28 and you're going to see a red box around it. You're going to right click and then you are going to navigate down to where it says mark tooth is missing. When I do that, you're going to notice that that tooth is now red. And that tooth is missing, and we would not be doing any documentations on that tooth. Now, let's say you accidentally mark the wrong tooth that's missing. And you're like, nope, 28 is not missing. That's okay. What you're going to do is you're going to hover your cursor over that red box. You're going to right click and you're going to restore the tooth, and now it's going to be black, and then that tooth can now be assessed. So just make sure that you have the appropriate teeth that are missing on this chart. So let's talk about this chart and how to read it and navigate it. When you look at this chart, you're going to see you have an upper box. That's for the maxillary. You can see the teeth 1 through 16. And then you can see the lower box, which is for the mandible, which you can see the teeth are from 17 to 32. Also note on the right side, you have a B on the upper, and on the lower is the L, and then same thing with the lower, L and B. This means buccal, and the L means lingual. So when you are documenting your recordings for 1 through 16, the top one is going to be for buccal, and down here it's going to be lingual. For the mandibular, buccal down here, and lingual here. It mirrors the mouth. Also note that right here on the right side, you have something called process. This allows you to change the sequence of your probings if you wish. I like the default from 1 to 16, 16 to 1, and so on. So I'm going to keep that as my sequence. Also note, in the middle of the chart, you have some icons that we are going to be using to help navigate on the appropriate areas that we're going to be documenting. So PD means periodontal depth. GM is for gingival margin. This is where we're going to be documenting recession and gingival overgrowth. FG is for furcations. MOB is for mobility. And then MGJ is for the width of attachment, which we will not be documenting. Also note that these acronyms are also on the left side. And you will see that as we enter in our numbers, they're going to be in the appropriate line. Also, we have bleeding and suppuration. And suppuration is also known as exudate or pus. So let's go ahead and begin trying to fill out our periodontal chart. The first tab I'm going to be doing is PD for periodontal depth, and I'm going to make sure that this is highlighted. My sequence is I'm going to start on number on the upper right, 1 to 16. And now 1 is missing, so I'm going to be starting on the distal buccal of number 2. You will see that there is this little blue box that hovers over. That lets me know that that is where I'm going to be starting my, to record my pocket depths. Now, when I start recording my pocket depths, I try to keep about 2 to 3 teeth in my head. It makes it a little easier to fill out this chart, and it makes it more efficient and effective. So I'm going to go ahead and start putting in my pockets. Now, when I start doing this, please note that the clinical attachment level is automatically going to be recorded. So, can you see how the pocket depth is coming in right here? And the clinical attachment level is automatically being calculated. Also note that the readings 1 to 3 are considered normal and healthy, and those numbers will always be in black. Anything 4 and above will be documented in red because that's going to indicate that there's probably some inflammation or some disease that's probably forming in that area. So I'll show you what that looks like. So we got a 4, 2, 3. Did you see how it skipped 4 and 5? 3, 2, 3. So I have 3 teeth documented. At this point, I'm going to go back and take a look at these areas, and I'm going to be checking for bleeding. There are 2 types of bleeding. We have spontaneous and delayed. Spontaneous bleeding means that the bleeding occurred immediately when you probed the tooth or the pockets. Delayed bleeding means that you've probed a couple of teeth, you go back and you start to see a little bit of bleeding. Bleeding is bleeding, and we're going to document both. So after I've evaluated these, I noticed, yep, that 4 was bleeding. So I'm going to click on that pocket, and down here, I'm going to click bleeding. You're going to notice that little circle has turned red. And then I'll say, you know what, this was bleeding, and that area was bleeding. So I'm going to go back to my probings, and I'm going to go back through, and I'm going to just go ahead and put in all of my pocket depths. Now watch what happens. It automatically, did you see that? It automatically redirects you to the distal lingual of number 16. Okay, it skips 5 and 4 because those are missing. And now it's going to automatically jump us down to 32 distal buccal. So if you forget where you're at, you can always kind of come back and see where that little blue box is. Okay, now I'm coming up to 30. And this pocket depth is a 10 millimeter pocket. How you record pocket depths that are greater than 9 is right here in this middle box. You're going to see a 10. If I click on that 10, you're going to notice that there is a 0 with an underline on it. If there's an underline underneath the number, we're going to add 10. So this is telling me that this is a 10 millimeter pocket. If I go to, let's say the lingual of number 30 is a 12 millimeter pocket, I am going to select 10, and then I'm going to click number 2. This tells me that this is a 12 millimeter pocket. Let's do that again. I'm going to say that the distal lingual is an 11 millimeter pocket. So I'm going to select 10, and then I'm going to click on number 1. And that's going to tell me that I have an 11 millimeter pocket. And then I'm going to finish my probings. And then I'm like, oh, you know what? I see some bleeding here. So I'm going to go ahead and select my bleeding. And maybe I see some suppuration on the lingual, so I'm going to hit suppuration. And do you see how that suppuration, that circle is going to turn yellow. Let's say that there's suppuration and bleeding. You're going to click on that and you're going to add the bleeding, and you're going to notice that the circles are now purple. So I have determined my periodontal, or documented my periodontal depths. Now I'm going to the GM. So I'm going to click on GM and make sure that that's highlighted. And this is where we're going to document, again, recession and gingival overgrowth. So let me show you recession. I'm going to go up to number 3. Now, when you are documenting recession or gingival overgrowth, make sure that you are assessing the full buccal or facial and the full lingual. So for number 3, I have GM highlighted. I have selected the tooth with recession. Now, when we are documenting recession, we always add the pocket depth and the recession to understand and document the clinical attachment level. Now, what's nice is that Eaglesoft will calculate that for us automatically. So right up here is your GM, and here's your clinical attachment level. So when I put my recession in here, you're going to notice that the clinical attachment level is going to change. So I am going to say that I have a clinical, recession of a 121 on the full buccal of number 3. Did you see how that clinical attachment level changed? So that is when we add the pocket depth with the recession, and that comes up with our clinical attachment level. Let's say our patient has gingival overgrowth. When we have gingival overgrowth, we are going to actually subtract that gingival overgrowth from the periodontal pocket. And how you document gingival overgrowth is, let's just say that number 6 has a 2 millimeter gingival overgrowth on the full facial. How you document that is down here in the middle. You are going to select minus. And then we're going to do 2, 2, I'm going to get rid of that. We're going to select that negative, and then we are going to select that negative and put 2. Now you are going to notice that if there is gingival overgrowth, we're always going to select the minus button and then the millimeters of the overgrowth. That is going to put a slash in the middle of that number. You're also going to notice, look at the clinical attachment level. It's subtracted. So that's kind of nice with an Eaglesoft because it automatically calculates it for you. Let's talk about furcation. Now you're going to notice that the FG is grayed out. The reason for that is because number 7 would never have a furcation involvement. You'll also know that this box, there's no lines in these boxes. So Eaglesoft has already determined which teeth are bifurcated or trifurcated. So if you take a look at number 2, you're going to see this Y. Number 3 has it. Number 4, 14, 15, 16, those teeth are trifurcated. So if we click on those, that FG opens up for us to select it. When you see that, we have the ability to add in the different furcations on the distal lingual, the buccal, and the mesiolingual. And you would determine the furcation through your Neighbor's probe. So if I thought that the distal lingual had a 2, buccal had a 2, and the mesiolingual had a 2, that would be how you would determine a trifurcated tooth. Now you're also going to see teeth in here that are bifurcated, which are going to be your premolars on the maxillary and the premolars and all the molars on the mandibular. So let's select number 19, and you're going to notice that these boxes, you have to select the box. So the buccal of number 19, I'm going to say has a level 2 furcation, and on the lingual is a level 2 furcation. So that is how you would document furcation. For mobility, we're going to select the mobility tab, and you're going to just select the tooth that has mobility. So I'm going to come down here and I'm going to select number 24, and I'm going to say it has 2 millimeters, or excuse me, class 2 mobility. You're going to notice right here that it's going to be on the mobility line. I'm going to say number 3 has a class 1 mobility and number 22 has class 1 mobility. So this is where you're going to notice the mobility. One other thing I just wanted to mention is that say you have a patient who has 100% bleeding on probing. Going back and forth with every circle can be exhausting and just very time consuming. So if your patient truly is 100% bleeding, what you can do is right next to bleeding, it says all. If you click on that, it will all turn to bleeding. And if you accidentally click that and you're like, oh no, I don't want that all bleeding, right next to it, it says none. If you click on that, it removes the bleeding. Once your periodontal chart is completely filled out, it is going to be checked by your instructor. At this point, if everything is good, you are going to click on the upper right save. Now, when you do this, this periodontal chart is going to be saved forever. Say you wanted to compare your probings. Up here on the upper ribbon, you are going to see some past probing depths that might have occurred. You have the periograph, and then you have the comparison. And you will see the different dates down here. And what's nice is that you can change the different tabs down here to see the different comparisons. I'm going to go ahead and close out of this, and I'm going to go back into my perio charting. Now, when we do this, what we want to do is say we're seeing a patient for maybe like a 6-week reeval, and we want to determine how the patient has responded to treatment. Well, this is very easy because what we can do is we can edit the previous. Now, we're not going to actually edit it, but what it does do is allows us to see past probings. So say I want to go and I saw this patient yesterday. I'm going to click on the most recent. I'm going to press use. When I do this, it brings up my past probings. So when I'm looking at past probings to the current probings that I'm taking for that day, I can see how this patient is responding to the treatment. I hope this helped, and thank you very much.